Jay, how are you doing this
Butter.
morning?
Hello, man.
Good to be sharing voices and faces.
Absolutely.
So what we thought we'd do for listeners who might tune into this, I thought it would be really cool. Jay Seifert, just in my opinion, he's a wonderful man. Of course, I'm biased, but he is going to be probably a regular guest on the Antigym TV. So I thought it would be cool to hear him talk about what that means to him, to hear him talk about his story, maybe how we met, because at least we think that's an interesting story, and kind of provide an intro to what this might mean to us, who this is. Jay Seifert, I call him the voice of God. I call him master. I call him friend. I call him father figure to me. I call him fellow human on this crazy trip that we're on. He's so much to me. And so I just thought it would be great to introduce him and hear it straight from the man's mouth.
Well, first of all, thank you very much for creating very low expectations so that I now have a really good chance I'm going to disappoint anybody who's unlucky enough to be watching this. So I was actually, Butter, I was actually trying to tell our story the other day to someone I had met. And I'm not sure I will ever be able to describe fully what our relationship is. In terms of how we met, there again, it's one of those things that you never quite plan out. But so in our case, what happened was we both happened to have the same parole officer. And so Butter was meeting with him one day and he was leaving, I was coming in. Anyway, it's actually, our story is a little more involved than that, and for me, it's a wonderful story because Butterworth's mother was a friend of mine at Miami of Ohio. We graduated on the same day in 1968. And what was so strange was that she, for all 4 years, was going out with this one guy. And we always expected that as soon as school was finished, they'd run off and get married. And what they did was, as soon as school was finished, they broke up. And Melinda went back to Metairie, Louisiana, where her parents were. My dad had bought a house in New Orleans, right next door to Metairie, and it was in the process of refurbishing it, remodeling. And I got my draft notice on the exact day that I graduated from Miami. And back in 1968, if you had a pulse, the Army wanted you real bad. And not that they would take good care of you and help assure that you would always have a pulse, but anyway, they wanted you anyway. So I got what was called a deferred enlistment. I enlisted, I drove down, packed up whatever I had, drove down to New Orleans, and spent that summer. And Melinda and I got to be pals, and which was tremendous for me. And I mean, she's a wonderful person, incredibly bright. And her plan had always been that she was going to, upon graduation, she and a friend of hers were going to move out to San Francisco. And she had, I think it was a yellow Firebird, really cool car. So we spent the summer together, mainly just pals. And she was the one person that wrote to me when I was in the Army. And that meant everything. If you can imagine mail calling, it's just fantastic when you go, Seifert, yes, yeah, you got a letter. Okay, good. So we stayed in touch. And then when I got out of the Army, after spectacular, the odds of actually winning in Vietnam would be a lot higher if I wasn't anywhere near what was going on. So they kicked me out. And I was heartbroken, but I recovered, and Melinda invited me to come out to San Francisco. I was discharged on November 25th of 1968 and flew out there and spent New Year's with her in the city, which was just San Francisco in 1968, 69. 69 was the summer of love, the Haight-Ashbury, the flower children, everything you can imagine. And it was an absolutely spectacular, magical place. So we had a wonderful time together. And at that point, I had to decide, gee, do I want to be here or, you know? So anyway, what happened was I decided that I for whatever reason, needed to get back to New Orleans. So I did. And then we stayed in touch. And in fact, my sister, I think for a while, moved out to San Francisco and actually became a roommate of Melinda's. So anyway, so this is probably a whole lot more than anybody wants to know. But several years ago, and I can't remember how many at this point, I get a letter from Melinda, and she says, if this is the Jay Seifert that I knew, and she wanted to let me know that her son, David Butterworth, was going to be coming to Austin, was actually thinking about relocating here. And so he and a then girlfriend of his from Arizona State, came out to our place out here in the country in Dripping Springs, Texas. And we all had dinner and we sat and we talked. And what happened was we developed a sense of, I don't know how to describe it. I still don't. I've tried so many times. I guess you could say we discovered that we were both on the same wavelength, that we, in terms of our values and the things that were important to us in life, shared a lot of that. And so during that period of time that Butter was in Austin, we got to be really good friends. And then when you decided to go back to California, we have continued to stay in touch. Our basic philosophy is the same. And what has been so wonderful and at times almost magical is that we can go months without talking to each other. We try real hard for that not to happen because we feel that it's both beneficial that we do that we stay in touch. But we can pick up excuse me, pardon the phone. We can.
It's not Melinda, is it?
It's your sis. It's Alex.
Oh, nice.
Yeah, it's her daughter's birthday today. Okay, so
that sounds pretty valuable or pretty important.
Oh yeah, but I will call her. But this is more important, and I really don't like the idea of saying to somebody, "I got somebody more important I got to talk to, so I'm going to leave you now." Okay, so anyway, so here's the deal, and maybe this will make more sense as the more we get into this. In terms of what I've been doing, so that there's some background here, and I Butter, please feel free to edit out 90% of this stuff. But in 2005, my wife Melinda, West Seifert, and I were paying attention to what was going on with corporate wellness programs. And all of a sudden they exploded. They were everywhere. Every company had to have an employee wellness program. And so we started to do a little bit of research. I have a master's degree from Tulane in social psychology. Melinda has a master's from Tulane in allied health sciences. And we approached two people, Todd Buchanan, who was and still is our family practitioner and a great friend now, and Ann Weber, who got her PhD in sociology from Johns Hopkins. And she and I got to know each other during the time that we were all living in Asheville, and have again stayed in touch. And so we said, wait a minute. What was going on with these corporate wellness programs is that it was basically the diet and exercise model. Mm-hmm. And it was do this, don't do that. Eat this, don't eat that. The programs that were out there and were doing exceedingly well, by the way, mm-hmm. were complicated, expensive, invasive, and rather than engage the target population to age, which was those employees who were most at risk for preventable and expensive to treat chronic illness, they were actually repelling that part of the employee group because of their messaging. And we took a look at what was going on. We studied the big guys, and I'll tell you what, the big guys were making money hand over fist. And that's precisely why their programs were designed to be so complicated. And they would have a coach assigned to you, and the coach would call you up exactly as you sat down to dinner at night and said, hey, let's talk about healthy eating. And the last thing you wanted to do then was talk to this guy. So we didn't see the changes were being made. So we said, wait a minute, they're ignoring everything that we know as social psychologists and others about human attitude and behavior and what it takes to change that. And it takes a heck of a lot because we are highly resistant to change as a species. And to ask someone to add a layer of responsibility onto their daily life when they, and this is even way back then, this is in 2005, when they're feeling stressed and overwhelmed and way too much to do. So that's asking a heck of a lot. And you also are basically setting yourself up for failure rather than success when you implement that program. And very quickly, one of the consequences of that failure that people weren't paying any attention to is the fact that if you have an individual who has struggled with personal health all their life, and you say, okay, this time it's going to be different, doggone it. We got this whiz-bang program. We're paying millions of dollars for it. And it's got all these bells and whistles, and it's really neat and all that stuff. And by the time we're done, we're all going to be healthy. When that individual fails at that program, and statistically the vast majority of them do, it reinforces the notion that this is, for you, an unattainable goal. In other words, they were doing everything wrong except making money.
Yeah.
So we put together a behavioral-based program, and the things that guided us were basically pretty simple. Remove the barriers to participation. Employ a communication, a language that was positive and realistic, and created the realistic expectation that you might be successful if you did these things. So it was pretty grassroots in terms of applied science, and it also used some other psychological mechanisms, I guess. Things, very simple things. Teamwork. Having someone that says, you're important to me, I'm going to be there for you. And a thing we know is that we will let ourselves down, but we won't let our friends down. And so if you're engaged in a team-like effort, and the objective is for each team member to improve the health status of the other, say a three-person team, then your commitment is much greater than if it's a commitment to yourself. So these are simple things. They're things that we've known for a very long time. So the other thing that happened that was kind of serendipitous, I suppose, is that I had a prior consulting relationship with a Texas organization of rural and community hospitals. And what I knew was that there were 150 small hospitals throughout the state of Texas that were struggling because of the urban-rural health disparity. And it continues today and is worse today for a whole number of reasons. So we have these small institutions out there in communities that don't have the knowledge, don't have the resources, and the big guys, the big employee wellness programs, they don't care about an institution organization with 100 employees. They want the 10,000 employees because then they make 10,000 times more money. So they're being totally ignored, and it kind of gave us like a lab. And so the first hospital was in Nacona, Texas, up in North Texas, northwest of Fort Worth. And they had a progressive administrator who understood what we were all about. He exhibited what I saw very rarely, and that was actual leadership. There's so much leadership in name only, and that concept is probably the most abused in the English language or in our culture. It's so easy to sign on and say, here we go, come on guys, rah rah, let's go do as I say, as I do, and then the administrator goes off as a queen or something like that. So we had this opportunity, and we knew we didn't want to screw this up. We wanted to take advantage of it. And we were able to hone our message from the very beginning. What we knew we had to do was upset any expectations that people had as they anticipated coming into a wellness program meeting, which they, for the most part, resented. So we went through several years doing this, basically from 2005 to 2010, and we had very good success. And again, our success had almost everything to do with the administrator And we also, before we ever arrived, had the administrator identify a facilitator. And what we said to them was, don't pick the facilitator because she's your nutritionist or she's your personal trainer. Pick your facilitator, and I say she because in healthcare, the majority of the people that we worked with were women. Pick her because if one of your employees is having a birthday and you want somebody to go around to all the employees and say, hey, it's Margaret's birthday, can I have $5 or $10 or something? And the one that exhibits the best relationships, the true personal leadership that you want with a program like this. We then had prepared a facilitator's guide, a handbook. We worked with them, we spent time with them, did PowerPoints, all this other stuff. And then we did pre-event, some pre-event promotion, posters and things like that, that were not specific, never said wellness program, but created some interest, we hoped, in this upcoming event. And we guarantee that you will have fun. There is a big key. So my job in the hour that I had or so to actually stand in front of the employees was basically simple. I'm going to get them engaged or I'm not. We're going to get them or we're not going to get them. And so we used all the stuff that's available. A lot of humor, some surprise, some really fun interactive things that we did with the audience, and then basically left it as here's the opportunity. You guys decide if it means anything to you. And we did some really interesting things too. We said, okay, we want, because we know this works, it's a great dynamic. We want 3 of you to kind of pair up, team off, grab a couple friends, grab the people that you care about and that you believe care about you. And it was interesting to do that because at that point in the presentation, I'd look out in the audience and somebody'd be going, hey, you 3 of us, we're going to be a team, huh? Okay, yeah. So they're fired up. And then what we also did was we were very careful to say, this is not a thing where if you don't win the prize, you don't succeed. We want everybody to feel that the time that they have spent doing this has been personally valuable to them. So what we ended up doing a lot of times, and the administrators loved this, was we created a sense of unity, a cohesiveness, because the people that opted in suddenly became within the hospital, the in group, okay? And there were a lot of times when I'd see people stand up and walk out because we handed them, are you in? You all right? If you're in, let us know. Who would then come back somewhat sheepishly, or a week or so later, come back to the facilitator and say, is it too late for me to do this? Because what they saw was that the other people were having some fun and they were part of this thing. Now, then what we had to do was keep delivering tangible benefits. So we did things like, what was it? Something Wednesday. And so if you were in the deal, we'd reserve tables at the cafeteria, reserved for Lone Start achievers and believers. And so here again, what we're doing is saying we're making this the kind of a thing that you want to be a part of. Yeah. And nobody likes to be left out of stuff. Okay, pretty simple. Everything was doing good. We were having some really good successes, and then something happened in March of 2010. And it was called and it's still very difficult for me to say these words out loud because it's so preposterous, the Affordable Care Act, where everybody in America was going to save $2,200 a year on their insurance. They were always going to be able to see the same doctor that they wanted to see, et cetera. And I have to always be careful when I knock the program because I have to say, I'm not knocking Obama. I'm not knocking the people. Well, I am not knocking the people. This succeeded because we understood. No, we planned this based on the fundamental ignorance of the American population. So in essence, we got sold a bill of goods in these poor hospitals that are out there. And there was a preventive component. There was money available to do preventive health and well-being. And in fact, one of the things that should have motivated hospitals to really get engaged in employee well-being was that they were ultimately going to be held, if they were a nonprofit hospital, they were going to be held or received any federal funds, they were going to be held responsible for not just the well-being of their employees, but ultimately the health and well-being of the communities that they served. Now, you think about that. That's in a lot of ways out of their control. So Obamacare, the ACA, was supposed to do a whole lot of stuff. I'm not saying that it didn't do some good things, like pre-existing conditions and things like that actually had to happen. But so what it did was, with a hospital that's struggling to meet all of like the Medicaid reimbursements changes and everything else, in order to adhere to the letter of the new law, they were so consumed that employee well-being sunk to like 126 on their priority list. And so a lot of that just never happened anymore. And a lot of times the administrators say, I know, it works, we need it, there are all the reasons, but I can't, until I get this whole thing organized and figured out, I don't have the bandwidth, I don't have the, so anyway, now at that time too, we were being approached by, and again, this was just somebody who knew what we were doing, an outfit in Houston, a health insurance outfit. And we were invited, and this is kind of a pivotal thing that happened. We were invited to present to the Houston Area Health Underwriters Association, the largest in the country association of basically health insurance. I might have said healthcare just now, but health insurance agents. And we made a presentation, and prior to that presentation, we had prepared, and Butter, if you give me a second, and maybe you just want to edit this out, let me go get a show and tell that'll help me explain what happened, because it's important. Okay, hang on. Hey, hello, Attila, hang on.
I like that. You look good over there.
Hey, thank you. Okay, here we go. Alrighty. Okay, lights, camera, action. So in anticipation of that, we prepared, in fact, this is one of them, it says AAHU members. And I don't know if you can see these, but what we did was a very simple thing. We took construction paper, different colors, and we printed on it. And it was our DVD that had basically our whole program and how it works and why it works and stuff like this. So we had these as giveaways, and they're brightly colored and all that stuff. And we designed them so that people would kind of go up and look at them. Well, and it says, and why does it matter to all of us? Try cost related to, how can AAHU members realize multiple benefits from employee wellness? So I was standing, there was a table, it was before the program started, and I was standing in the back room, kind of, hi, how are you, and stuff like that. And these two women walked up, and these things were all spread out on the table. And they walked up, and I heard one of them say, oh, what is this? This is neat. And she went and she picked it up. She says, AAHU members. And she read employee wellness. And when she said wellness, she dropped it like it was a hot coal. And that taught me everything I needed to know. We were using, despite the fact that we were saying we've got to be careful with our verbal and nonverbal communication, the language, the symbols, the imagery that we use, and we were violating that rule. We were promoting a concept that was perceived negatively by most of the people that we needed to reach. Everybody wants to be healthy. They don't want to do what they think they have to do in order to get healthy. And so right away we're saying, boy, you're going to hate this. So that was huge. That was gigantic for me to have had that experience, to realize that we needed to. So Lone Start Wellness was no more. Lone Start Now was a program that was designed, a self-directed, self-administered program designed for those individuals that realized that it was important for them to take charge of their own personal health and well-being. And here was a behavioral strategy that would help them accomplish that. So that was kind of a watershed moment. It changed our communications. It changed a lot of other things. The other thing that happened there too was that we were, I don't know how to say this. There was a large outfit in Houston that decided that they absolutely positively had to employ our initiative with every one of their clients. And the long and the short of it was that what they were really interested in doing was getting all of our material. It was kind of like we got set up and knocked down like a bowling pin. Pretty expensive lesson, one that honestly it took us a long time to get over.
Yeah.
But so and I will admit naivete, because my attitude going into this with anybody that we worked with was that they want the same outcome we want, and for the same reasons. And so I was disabused of that notion, and that's now. Interestingly, 2006 is when a lot of employers, based on some articles that were written here and there, realized that they were spending way too much money on employee health care. This is 2006. And how much were they spending? 7% of their gross profit on healthcare. By only a few years later, that number had jumped to 50%. So they're highly motivated to do this. If we fast forward to today, what's really interesting is that the high watermark for employee wellness was probably around 2015, and maybe even a little bit before. And what had happened was employers had simply tried and failed and tried and failed way too many times. The big guys in the business were continuing to do what they were doing, which getting people to enroll, doing all these expensive things, all these invasive things, et cetera, and still not delivering the result. So the problem we face today is that diabetes, hypertension, and obesity are the deadly combo for people who might be at risk for COVID. And if you have any one of those three factors, and if indeed you have all three factors, your chances of having a really successful recovery are very, very low. We have known forever that preventable and expensive to treat illnesses are consuming our healthcare system. In the United States, we spend over $11,000 per person per year on healthcare. Would you not think that of all of the nations, and we outpace every, we look at something like life expectancy, for all of it, we're number one in expenditures. Life expectancy, we're 38th. We're behind Cuba. Now, for a long, long time, we have not been getting very much bang for our buck. And there are all kinds of reasons for this. And maybe what we'll do, Butter, is we'll make this another one of the things we talk about. But right now, we're at a really critical juncture. We have been spending trillions to provide healthcare to people, many of whom don't get better. The people that have been the most at risk traditionally have done the worst, have consumed all the ICU days, have been on ventilators, all that other stuff. Insurance renewal is about to happen this fall. And we're all going along like, doop, 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 everything's fine, everything's cool. Wait until the insurance premiums are published at the end of this year. We have $4 trillion that we somehow, some way have to account for. And what I have noticed, and I've been paying very close attention, is all of the messaging that's coming out of the policymakers, the politicians, the experts, the whatever. I have never once heard anyone suggest, particularly with the issue of obesity, that we have got to find a way to get people who are each one of us is most in control of our own health, right? Nobody makes the decision to put this in our mouth and not this, except us. So it's the ounce of prevention, many, many tons of cure, but no one is willing to use two words that I've never heard a politician use in all the years we've done this: personal responsibility. It is no more or no less than that. So here's the challenge, and it's a big one. Can we get our healthcare resource consuming population to the point where everybody understands that in this era of division and where we are looking for ways to divide ourselves because of race, religion, education, ethnicity, gender, whatever, that the one thing that unites us, and you think about this more than anything else, is that every one of us, when we need it, is dependent upon the same healthcare system. Now, it's not the same in terms of accessibility, in terms of cost, in terms of and even performance, because of the inequities, the disparities between this part of the population and this part. I had a friend the other day that said, basically the healthcare system is like the Rolls Royce. It's out there. It can provide the best care in the world. People come from all over to the Mayo Clinic and to Johns Hopkins and places like that because they know that it's the best care. It's also the most expensive care. So if you're in the 1%, you're a happy guy. And in fact, if you're basically in the top 20% of our population in terms of income, you're okay. Here's the issue. The vast majority of us, the 60%, are responsible for a very large percentage of the population that is indigent, Medicaid eligible, and most at risk for preventable chronic illness. And we are doing absolutely nothing to reduce the size of that population. So during this election, if we survive it, there will have been some referendum on the kind of healthcare system we have. How do we provide and pay for healthcare in America? We hear a lot about Medicare for all, and we hear that on the left. On the right, and the left is saying healthcare is a right. Healthcare is a right. On the right, the people are saying, Otter's joining in. The people are saying no, it's a privilege. Now we can do another session, and should, on what does that mean, and what is the difference between privately funded and publicly funded healthcare. But here's the bottom line, Butter. No system will survive. If you look at the demographics and you look at the cost of care currently, and you factor in what we're going to have to factor in after COVID, we don't have the resources to address everybody's need. We don't have it right now. And the very scary thing is that if we have a avian flu or something that comes along, we work our way through COVID, but something comes along that is worse, more aggressive, etc., we're going to be at the point where there's going to be a triage in the emergency room. And if you are a 65-year-old woman with hypertension, diabetes, and you are obese, you may not get any care, because you're going to be that bad risk. It happens on the battlefield. This guy we can't help. I'm sorry, put him to the side. We got to devote our resources and our energy to the people that we can save. Now that's pretty scary, but where we are right now and where we're headed is precisely that. And we're doing an excellent job of sticking our head in the sand and not paying attention to these things. And here's what we have to do, Butter. And this is the conversation I try to have with anybody I run into until they say, "Will you shut up and get out of my face? I don't need to hear this." We have an opportunity here. Why do we as consumers let ourselves like this by the healthcare system? I mean, it's criminal. And we got lots and lots and lots of horror stories. We don't do this with other things. If we went out and bought a car and it didn't work, we have lemon laws, right? But we don't have anything like that to protect us as consumers. And so the real rub here is that healthcare is the way we provide it and finance it is basically it's based on a market system and a profit motive, which doesn't happen in the countries that are successful in terms of making good, even excellent care available to their entire populations. And none of them are without faults, but none of them are as searingly ridiculous and inequitable as what we have. If your house burns down and you decided that you didn't want fire insurance, well, is the fire department going to, well, yeah, they're going to come out and put your fire out. That's what happens here. Something happens, you go to the ER, we're going to make certain you will do everything we can to keep you alive. But at that point, since you don't have fire insurance, you're sitting there looking at the smoldering ruins of what used to be your house, and you go, well, doggone it, I sure wish I had fire insurance. But what do? We say, we'll figure it out. Don't worry about it. So we've got a hospital cost reimbursement system that is so totally screwed up and skewed and everything else. But what happens here? The hospital is obliged to provide care. They're not going to kick you out on the street because you don't have insurance. Well, somebody's got to make that up. And that somebody is every one of us who somehow, some way is paying for their own health care in this country. So that's why there's an urgency. And the challenge, to put it in just so many words, and this seems totally insurmountable to me at most times, is can we ever get to the point where taking responsibility for our own personal health and well-being is something not so much that we have to do, but something that we want to do? How do we create a system that incentivizes that kind of positive behavior and does it in a way without adding additional stress, additional burden? In other words, how do we make it a positive instead of a negative? If we can figure out how to do that, A, our place in heaven is assured, and B, we'll have so much money we won't know what to do with it. So that's where we're at, Butter.
Yeah, it sounds like if we made that assured, or if we made that a possibility in our everyday life, then heaven would be right in front of us, right? Heaven is now if we're living like that.
Relative.
Yeah, and okay. I was thinking, like, if someone shoves personal responsibility to the side, this is what I'm hearing you say a little bit. They shove personal responsibility to the side, and they depend on the healthcare system. They're bound to be let down, and that's a problem. And so the alternative, like you're saying, is that we don't rely on this other entity or this institutional disaster, and we say, what am I going to do? So I like what you're saying, because it puts the onus on us, as people, as humans, and the other element that I loved was it sounds to me like a lot of our health status is perceptual. And that the way we look at it matters a great deal. Do you want to touch on that a little bit?
Yeah, because one of the things that creates an additional barrier for any kind of program like this, or an initiative, and let me digress. This commonality, this is precisely the whole idea of Antigym. Well, this is anti-wellness as we know it. So we want to achieve an outcome. And that outcome is going to require some real attitudinal change or adjustment or whatever. And again, it's challenging because we're at a time where if you ask somebody, hey, do you want to take on anything new? Hell no, I can't keep up with what's going on right now. Leave me alone. Go away, go away. So we got the COVID-15 happening. People are drinking more than they should. They're eating more than they should. They're not moving. They're doing virtually everything wrong because they're overwhelmed. And so that's what makes this even more of a challenge. But the other thing is, every time somebody says this isn't about fat shaming, this is about protecting your life. Well, they go, no, it's about fat shaming. You're shaming fat people. It's not my fault that I weigh 800 pounds. And that movement has become particularly militant. Somehow, some way, we have to be able to say, wait, 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 stop deluding yourself. This is not good. It's not good for you. It's not good for us. In the years that we were doing the well-being programs, I can't tell you how many times somebody would come up to me after a presentation, and it was several. It wasn't just once. But I remember one case was in Nebraska, and this nurse, she's an RN, she takes care of people. She came over to me and she was just livid. She said, and she said this loud enough to make certain this person heard her. She said, I am sick and tired of paying for that person's healthcare costs because they won't back away from the Doritos or whatever she said. Well, there's a lot of that sentiment that is felt, and it is justifiable in the sense that if you let's say you and I constituted an entire group of a car insurance company, auto insurance, right? You and I are the group. We both pay the same premiums. Now, every time I back out of the driveway, I hit something. I can't drive 10 feet without having an accident. I do this every day. You have never, ever, ever had an accident. But guess whose premiums are going to increase? Because you and I are the group? Yeah. Both of ours. And you're going, what the hell? I never had an accident. Well, I'm sorry, but you're in a group and this guy has a lot of accidents. Well, that's what's going on right now with healthcare. So with very few exceptions, a group behavior is going to determine how it's structured, how it's provided, how it's paid for, all that other stuff. So there are so many inequities here. And the other problem is in our tremendously divided and polarized system that we have, as soon as you say Medicare for all, the guy on the left says, it makes sense. Bernie Sanders is right. Nobody's got the guts to admit that this guy is saying the right things. If you look at how Medicare and Medicaid have performed ever since 1965, it's very hard to argue with them. The guy on the right is going, socialized medicine, socialized medicine. We don't want do you want the government making decisions instead of your doctor? Well, hell, Obamacare has gone a long way toward making certain that that's already where we're at. And while we're on that topic, the real problem with Obamacare, if that guy had gotten elected in 2008 and he said, okay, I'll tell you what, guys, this is so important to our country. And if Biden, let's say Biden would get elected, and he'd say, this is so important to our country, we're going to do Medicare for all. We're going to take that big leap from where we are to where we need to be. And there's an old expression, you can't cross a chasm in two leaps. You better make it all in the first time. So what Obamacare did was, it was a little half step. And it said, okay, we're going to do some things here that haven't been done before, and they're good things. But it didn't take the full leap. So the idea that we are going to improve upon Obamacare is still not going to get us to where we need to be. And the status quo is unsustainable. So that is a political reality that we're facing and will continue to face.
So I love that it comes back time and time again to this support network, this community, that's what matters, that's what may be really meaningful to people. It reminds me of that Camus, expression where, it's like, don't walk in front of me, I might not follow. Don't walk behind me, I might not lead. Just walk next to me and be my friend. And it seems to bring it back again and again to this like conversation that we're having in real life with our friend and our family members, and that those are the people we want to either be with and also talk and do this for. That's why it's meaningful. So yeah, I love that.
But this is the parallel that has always existed here between us. You've always been doing, and you've been delving way deeper into kind of the philosophical foundation of what it is that we're doing. And you've been doing it so much more directly on a person-to-person basis with the people that you engage via Zenso. And ours has been, organizationally with groups and so on. But those are the fundamentals. And what we need to be doing there is we need to take your ability to tap into those the psychological interpersonal dynamics of what it really is going to take, and then take that and then craft a message that then can be applied to the broader population. Somebody has to do this, and so this might be the opportunity that and neither of us have been sitting around passively waiting for something to present itself, because that isn't going to happen. But somebody's also got to say, wait, for all the reasons that I've just been going on about. This is unsustainable. And look, it's unsustainable at a personal level as well. Psychologically, philosophically, all these things. There isn't much that feels better than being able to define a task clearly and unambiguously, and then be able to successfully complete it. And I think that's what people are longing for. They want another example of an encounter that I had, forget where, I was doing the program, and a woman, I think she was an RN or an LVN, she was one or the other. She came up to me, and she waited till everybody was gone. And she was a pretty big person. And I could tell she was really, 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 this is a really emotional thing for her. She said, and this is almost verbatim because I remember it, she said, I can't tell you how much I want to do this and how much I need to be successful. My entire family is obese. Everybody in my family now has diabetes. I don't want this for myself. I don't want this for my kids. But the thing I have to tell you is I cannot stand another failure. And I imagine that, to realize how unbelievably important this is, but to also start with the expectation that you're going to fail, which means that you will.
Well, we have this system that's in place, and maybe another word for that is culture. Maybe another word for that is society, or what's been done for decades and decades and decades, that is not allowing a person like that to have a chance to feel like they can be successful. They've clearly, the weight is on her enough where it feels pressing, and yet at the same time it feels not achievable. And I think important in this is that another idea is that there's not a one size fits all. Context matters.
Exactly.
We have also a system that at the same time is saying you're helpless, you can't do it.
Right.
And at the same time it's saying that, it's also shooting from every conceivable angle this fire hose, in a fire hose kind of way, messaging, which is also saying, buy me, do this, you will be successful if you purchase my bell or my whistle, right? Like my secret program, my fat loss trick. And so even in all of that information, there is some information that might be helpful. And yet, like I said before, context matters, and maybe that information that would be helpful to you might not be helpful to me, and another little sliver of information might be helpful to me. And that is important. So considering all of this, it's certainly complex, and it sounds like a pretty good challenge.
Great way to look at it. Great way to look at it. It was like that. There's a quote from somebody that says, "Did you fail? Good. Fail again. This time better. You know, be a better failure."
Yeah. What's that? William Blake line. You know, to the person who has to the person who has follied is the person who will become wise. Right. Like only through a lifetime of folly will you learn. You know what's actually going on.
Yeah. Okay. So here's the okay. It's a challenge. I mean, it's crazy. This is probably one of these Don Quixote kinds of things, and we're tilting at windmills we're dreaming the impossible dream to fight the unbeatable foe. Okay.
Like you're saying, real quick, like you're saying though, that challenge. What's that old expression? Smile at obstacles. Like if there's a way to make it not so serious. Yeah, it's an almost unbeatable challenge.
Yes.
If we can have some fun with it and maybe not think it's a challenge, not really care, right? It's that kind of that flipped way, that kind of Eastern mentality of like the person who is able to craft success is the person who just doesn't give a fuck in some respects sometimes. Like that effort of the child, right, who's lost in play and wonder and exploration, this is the real engagement that yields fruitfulness. I don't know. I love how you're bringing that kind of attitude piece into it, because I think that clearly would help.
Maybe that's what we do is we get a bunch of people together and we say, okay, realistically, that's our expectation. With everything going on right now, this is absolutely the wrong time to start anything like this. And what we're going to do is we're going to go out there, we're going to fall flat on our face, and then we're going to just enjoy the hell out of it. Now, if by some miracle in the process of doing this, because we no longer have fear of failure, that's our expectation, that's where we all plan to end up, then wouldn't it be a surprise to see just what might happen if we said, hey, totally no pressure, let's go out there and have some fun. What the hell, we're all doomed anyway, world's going to hell in a handbasket. So what do we care?
There's a song that our boy has been listening to a lot lately, and it comes from a story called Pete the Cat. And the song is basically about Pete's shoes. And the song starts, I love my white shoes. 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 And then it goes, oh no, I stepped in a pile of strawberries. What happened? My shoes are all red, basically. And it's like, did Pete cry? No, Pete didn't cry. He just kept going along, singing his song. And then it goes, I love my red shoes. I love my red shoes. And it's like, I don't know, I love that. It's so simple, but it's great.
God, what wisdom. I mean, that's it. It's pure wisdom. I mean, you're never going to keep them white. You may as well go with the flow.
Yeah.
They're going to be red and brown and black and all kinds of other things.
Yeah.
Okay. So, and that's kind of what we have to figure out how to do here, as you say, is get all of the extraneous, it's not extraneous, but get the counterproductive. We've got to be able to put all of that in its place. And I think in the process of doing this, we have to give people the opportunity to take a deep, deep breath. And somehow, as we're trying to engage them in a process, be able to say, we also want you all to take a big time out, because we aren't going to be able to do this if it is the 29th thing on your daily list of stuff you got to get to. If it is, however, say it's not a discrete have to that goes on my list and is going to sink way down to the bottom, what if we create opportunities to fulfill very small want-tos that we know are important attitudinally in order to make any kind of behavior change that gets us headed in the right direction. Way more smarter people than me are, I'm sure, are dealing with this and contemplating it. And maybe what I need to do is make a more concerted effort to find out what is going on out there. But
it just reminded me of a few things. I used to say to a buddy of mine, like wake up in the morning, I'd send him a text or call him, and I'd be like, hey, what are you doing? And he'd be like, oh, I'm doing, and I'd be like, he'd ask me what I'm doing, and I go, I put on my get somewhere shoes. I'm going to get somewhere. And I just thought of it like that falls right in line though with the I always have to be doing something kind of mentality. And I don't know if you noticed, like a second ago or 30 seconds ago, I was looking down at my phone because I saw this little picture earlier today and I wanted to share it because it goes in line with what you were saying about people are so busy and they don't have time to slow down. Well, this little, I don't know if we can put it up here.
Yeah. Yeah. Okay, I can read. Feeling the need to be busy all the time is a trauma response and fear-based distraction. Whoa.
And then, so underneath it has the caption. It says this guy tapered bodies on Instagram. I like following some of his posts and hearing his or reading his insights. And he says, you got to slow down. You need to feel to heal. And I like that. And he said, or else you just get used to the hamster wheel. He writes. And then underneath it says that what you'd be forced to acknowledge if you did slow down was all the things that you're trying to cover up, basically. And so I was thinking about that, like putting on the get some.
Are you back?
I'm back. Let me hit.
Okay.
Oh, and it says recording still. So I don't know what we missed or lost, but I think I was saying, I going back to that, putting on the get somewhere shoes.
Yeah. Yeah.
And I felt like immediately when you were speaking and I'm saying it now, like to change that. And it's more like, no, I want to put on my get to shoes, because then everything that happens in the day is not, I need to, like you're saying, it's, I want to, I get to. And it just puts this in a more, a space of gratitude. Yeah. So to speak. If I feel like I always need to get somewhere, I'm spinning that hamster wheel.
Well, let's put this into some kind of a coherent statement. And it's that whole thing about second right answer. It'll be the first right answer, but then there'll be the second, the third, and the 15th. But I would love to get our pal Ann involved in this. Even if it's just us doing what we're doing and sending it over and saying, what do you think? Because she would go, oh my God, blah, 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 blah. And she, and except that in all of the blah, blah, there would be these pearls that would be so important, because this is, and that's the other thing. If people are going to take this seriously, there has to be a credible, it needs to be a credible message from a credible source, delivered in a way that resonates. And part of the other issue, part of what we're going to have issues with all messaging in this country, is who's the messenger. And in our polarized state, do I discount automatically the message because the messenger doesn't look like me, talk like me, isn't my same age and the same education, stuff like that. And so that is also one of the things that I tried to do too with when we chose facilitators was find somebody that I thought was most representative of the people we're trying to reach. And in some cases that meant an Hispanic person, because there were more Hispanic workers than anything else. And yet if we can get over that instant reaction that they're not like me, I'm not going to support them, that's when we get to the point where we realize that here's a good message. It doesn't matter who it comes from, because it matters. It's an important message for me and my family. And one of the things that I used to say and still do is that this really is a tremendous case of a rising tide raising all ships. And that is that if we can put a dent at all, I mean, even a small dent, I'll have to go get the statistics again, but if you can eliminate smoking, bad nutrition, and inactivity, and that's a huge ask, something like 80% of our healthcare costs go away.
Jeez. Well, especially because those three things you mentioned, aside from the first one, which I don't know, seems to be more clear cut, but the the second one and the third one, nutrition and physical activity, there's a lot of myths floating in there, and there's a lot of bad information or evil information. And I'm just thinking, it just seems like so many people are fighting over who's right or what's right. And what you said earlier, what if we instead focused on, it's not the first move we make that's right. It's not the second or the fifth right answer. It's the 1,022nd.
Yeah, precisely.
And then it's the 1,023rd. And it's never the right answer. It's just what's right now. And then that's constantly changing. What if we focused on, something like that?
Yeah. And the fact that the only thing that matters is the incremental improvement that occurs. And it doesn't matter that you come in first or eighth or whatever, because if we stop looking at this as a zero-sum game, and we're simply asking a question to anybody who wants to listen, and that is the health and well-being of yourself and your family important? And if you can honestly say, yes, it is. And if you go, nah, what the hell, I don't care. Okay, great. Good luck, man. I hope you. But if it is, then will you also accept, and this is where we get down to basic logic. And one of the things we're doing right now is we're telling people logic doesn't apply, because we're putting out the most ridiculous things that we let these idiots get away with stuff that we wouldn't let our kids get away with. You wouldn't let bricks go out and tell a bald-faced lie based on the most warped logic in the whole world, but we accept that from people in power. Anyway.
Yeah.
So yes. So there is an ask here, and I think this is important, that there is an ask to assume a degree of personal responsibility for your health and well-being. That's unavoidable. We aren't going to get around it. I don't care what they do, but nobody's got the guts. Nobody's got the political will to even utter those words. Oh my God.
Yeah, it definitely puts me.
It's a huge hump.
I think what we ought to do is continue this conversation. Let you go on and call your sis, and I'll move on. And our boy came into the garage once, and I'm gonna go. I got some other stuff. We got some couches to move out, and
Yeah. Okay.
Mother-in-law's house, but anyway, we'll continue the conversation. But it all steers me closer to like the people who are really, I want to say pioneering, but just people who are really looking at this in a more holistic sense, in a more biological, energetic sense, from the cell, the function of the cell upward and outward, and the interconnectedness of everything, and also more in the direction of people who wrote stuff like Ivan Illich and deschooling society and kind of anti-medical establishment, not in the sense that medicine can't be good, but that there's so many issues we really need to face and look at. And so I look forward to continuing this conversation with you. I think it was a good introduction because we got to hear where you're coming from. And I would love to get Ann on here, like you said, too, because I feel like I could ask you guys a question, maybe, and you could say a few words, and then Ann could say a million. And that would be great. And so if you don't mind, I'd love for you to.
Oh, no, absolutely.
And I'll send her a short line too.
Oh, would you? I'll do that. In fact, when we get done here, I'll holler at her.
Okay. And then today I'll send her an email too, because I haven't shared with her in a year probably. So
okay. And when I assume the next thing you will do is edit this down. Yes.
Yeah, there's a few parts I'll edit down. I'll whatever.
And let's send it to her.
Okay. Yeah, it might take me a little bit to figure out how to do that, but I'll even if it was the complete version, there's not much I need to edit out probably.
All right.
But there's like I don't know. I mean, 20 seconds that I could edit out. So I don't know. I'll figure it out.
Okay.
Or I won't.
Sounds like a plan.
Or I won't. You know, what you
And-
see, what you get. And there you go.
Exactly. Let me know when you're truck hunting and trailer hunting and stuff.
You're going to be the first person I send about truck questions.
Excellent.
And then if you could give me your insight directly, and then also reach out to your friend, because I think we would really love to get some insight from people who have been around trucks and people who have done the trailer life, like your friend Joe.
Yeah.
Right?
Yeah. Bill, Bob.
Oh, Bob. Yeah.
Bob Miller.
Yeah.
Okay.
So I'd love that.
Sounds like a plan.
Amazing.
Hi to Bricks. Hi to Shay.
Yeah. What do you got there in the front of the screen? Just real quick. Or back in the back. What do you got in the background there?
Barely hears what my name is, but that's from a postmaster meeting. I don't know.
Oh, I don't know. I thought it's that lamp. I didn't know what it was. I just saw that thing sticking out.
Yeah. I'm in the office. Okay.
Amazing.
Dominate.
Whatever.
Until next time.
Pleasure, Jay.
Okay. Same here, butter.
Bye.
Take care.
Bye.